Hi, my name is Tristan Smolarczyk. We had our first SP last week, and honestly, I thought it went a lot better in my head than I guess it really did. There were a lot of things that went wrong, a lot of things feel like I did really well, and I often get told I do really well as a clinician. I feel like when I was in the room with a patient, although as frustrating as the pathology was and as inconsistent as all of our evals were, I feel like the one thing I was able to do right with this patient, I was able to make her feel really comfortable. I wanted her to just try to sit there and be as comfortable as possible. I didn't want to put her in a position that was in the most pain, because the patient was in pain in almost all ranges of motion and was restricted severely. And so I wanted to make sure that I wasn't causing the patient more pain overall. I feel like I also, towards the end, when I told the patient my diagnosis, I feel like I did really well in describing what the pathology was. Because I asked the patient, I was like, do you know what this is? And blah, blah, blah. And the patient at first sat there and was like, no, I don't know what that is. Can you explain it to me? And I was like, yeah. And so I kind of dove in as deeply of my knowledge of that pathology, described it to him the best way possible, told them why I thought they had that, and that why I either referred them or I didn't, blah, blah, blah. I just feel like that aspect of being patient-centered is my strong point. Weaknesses, there's a lot of them, to be honest. Range of motion, I was prepared to use a goniometer. Didn't, though, because I didn't want to put the patient in more pain, but I did not specifically put that on my SOAP note. My SOAP note is probably where I failed the most. I did a lot with the patient in the room, but I realized looking back, I did not actually put that on the SOAP note. Like, I had the patient roll the shoulders back, and that caused pain, and so I did not write that on the SOAP note. And I feel like if I just was more descriptive about my process with the patient on my SOAP note, would have been a lot better in the long run. I feel like if I had more time in the room, I probably could have had a lot more chance to get more information with the patient. I was kind of pressed for time. Didn't do any special tests, which some people were able to do special tests on patients. I wasn't even able to touch the patient without them being in pain. My goal was not to cause them more pain. But now I look back at it, I could have probably done a couple things, one or two, just to test, and see if they're even capable of it. And then if not, I could have even just wrote that on my SOAP note, like, test later. Manual muscle test, I didn't even honestly think about it just because of the pain, but there's some stuff down here I probably could have done lower. And myotomes and dermatomes, I couldn't do myotomes because I didn't do manual muscle testing either, but I did do dermatomes, and one thing I didn't do was put it on the SOAP note. And if I did put it on the SOAP note, which I honestly can't remember, it wasn't very descriptive at all. I feel like I could have had some better follow-up questions, but overall, I feel like I did a good job staying patient-centered. Just need to work on the overall process and SOAP notes.